Today we're going to discuss the prescription preparation process. After this lecture, you should be able to comprehend the prescription preparation process, as well as execute the necessary steps to prepare a prescription. So we're going to start with the types as well as the parts of prescriptions. Remember that prescription laws vary by state, so it's important that you check your state's local laws before starting your career just to ensure that you're up to date and abiding by all of your relevant laws and checking all the boxes there. So starting with the requirements for all prescriptions, you have the patient's name, patient phone number, patient date of birth, the physician's office name, address, and phone number, the physician's signature, the date the prescription was written, the medication name, strength, quantity, dose, and dosage form, the administration route of the medication, the directions for use or the SIG, as well as the refill information. I've included an example prescription for you here. Pause the video now and see if you can find all of these components on this prescription. So now we're going to go through them one by one. First, we have the patient's name, the patient's phone number, the patient's date of birth, the physician's office name, the address and phone number, as well as the fax number, the physician's signature, the date the prescription was written, and the medication name, strength, dosage form, the directions as well as the route of administration for the medication, the quantity, and the refill information. Now we're going to discuss something called an origin code. These are commonly used in the software and the billing part of the prescription preparation process. The origin code just says how the prescription was produced and delivered. Here we have 4 examples of origin codes. So starting with an origin code of 1, this is a written prescription. These are typed and printed or handwritten, so these are like your prescription pads. Then an origin code of 2 is a phoned-in prescription when the prescriber phones the prescription over to the pharmacy or calls it in. An origin code of 3 is an electronic prescription where a prescriber sends a prescription in the form of an electronic transmission similar to an email to the pharmacy. So most of your pharmacies are going to use a software package that links the doctor directly to you, the pharmacy, so that this is a seamless process and everything gets to you really quickly. Then an origin code of 4 is faxed. So these are going to be sent via a fax machine to the pharmacy straight from a prescriber. The pharmacy does have to retain the transmission information that's in the header and the footer, so the date and the time that the fax was received. So just don't tear that off so that you can keep it in your records. We also commonly see DAW codes or dispense as written codes. These are also used for insurance purposes. So a 0 is a generic substitution is permitted. It's both legal and commonplace to dispense generic in place of brand medications when they're available. It is required by law to have the words generic for on the prescription label. And a lot of software packages will go ahead and do this for you. So when you choose like generic furosemide for your prescription, it'll go ahead and add to the label generic for Lasix. Then you have a DAW code of 1, which means the brand name is medically necessary. So this is when the doctor mandates that the pharmacy dispense the brand name medication for the patient. And then a DAW code of 2 is when the patient requests the brand name. So the patient mandates that the pharmacy dispense the brand name because they have a preference for it. We're going to dive a little bit deeper into controlled substances now. The Controlled Substance Act of 1970, or CSA, is responsible for establishing the Drug Enforcement Administration, also sometimes called the Drug Enforcement Agency, or DEA, as well as forming drug schedules. So the drugs and other substances that are considered controlled substances under the CSA are all divided into 5 schedules. They receive their schedule based on whether or not it has a currently accepted medical use and treatment in the United States, as well as its relative likelihood of causing dependence, which we're going to dive a little bit more into that idea in a few seconds. So factors associated with controlled substances. First is addiction. Addiction is a complex disorder characterized by compulsive drug use. While each drug produces different effects, all share one thing in common, and that's that repeated use does alter the way the brain looks and functions. This is why we do consider addiction to be a disease, because it does change the body. Then we have drug abuse. This is the habitual taking of addictive substances. And then finally, tolerance. This is when a patient's reaction to a specific drug is progressively reduced, requiring an increased dose to achieve the desired effect. So this is when a patient has been taking a medication for a while. Unfortunately, the medication no longer works as well for them, so they have to take a higher dose in order to get the same effect that they otherwise would have gotten when they took their regular dose beforehand. Then we have withdrawal. So this is onset of symptoms that results from discontinuing the use of a substance, and this can be psychological or physical. Psychological dependence is the dependency of the mind to continue the same pattern of behavior, whereas physical dependence is awareness of withdrawal symptoms such as seizures, sweating, and tremors when use of a substance is discontinued. So one affects the brain, whereas the other is producing those physical symptoms. So now we're going to dive into the different classes of scheduled medications as well as examples and their description. Starting with C1 medications, these have no accepted medical use here in America. Examples of these are heroin and LSD, and these have a high potential for abuse. So these are going to be the highest regulated, not available in pharmacy medications. Then you have C2 medications, which have a high dependence factor. These are oxycodone, fentanyl, things like that. They have a high potential for abuse, which may lead to severe psychological or physical dependence. Moving on to C3, these have a moderate dependence factors. Examples of these include buprenorphine and ketamine. They have moderate to low physical dependence, but these typically have a higher psychological dependence. So less of those physical symptoms that we see, but more brain involvement in the dependence. C4 has a less dependence factor. This is like alprazolam, diazepam, all of your benzodiazepines. They actually have a low potential for abuse. C5 is a slight dependence factor, and that's things like Lomotil. They have a low potential for abuse, and they only have a limited quantity of narcotics in their formulation. All other prescription medications are considered non-controlled medications. You'll also hear them called non-controlled legend medications. Examples of these are lisinopril and losartan. They have very little to no abuse potential. And finally, over-the-counter or OTC medications are non-prescription medications. They include things like Tylenol or acetaminophen and ibuprofen, and they do not require a prescription. So just a quick note, since Schedule II medications are so easily abused, there are greater restrictions on that schedule than any other. Schedule 3 through 5 also has some pretty strict restrictions, but it's less stringent than that of Schedule 2. And then non-controlled medications have the least stringent guidelines, and they are less than Schedule 3 through 5. So Schedule 2 has the hardest guidelines to follow. Schedule 3 through 5 has a little bit easier, but they're still pretty stringent, and non-controlled medications are much more relaxed. And we're going to talk about all of these in the next few minutes. So starting with the refill limits on prescriptions. Schedule 2 medications are not allowed to be prescribed refills. Every prescription is only valid for one fill only. So once you get your hard copy prescription and take it to the pharmacy, you can only fill it that one time, and then you have to go back to the doctor. Schedule 3 through 5 medications can be prescribed 5 refills, which allows the prescription to be filled for a total of 6 times. So when you get the prescription, you take it to the pharmacy, you get it filled that one time, and you'll also have 5 additional fills on top of that fill for a total of 6 fills. Non-controlled medications may be prescribed up to 1 year's worth of refills. This allows the prescription to be filled as many times as needed during that year. When I say as many times as needed during that year, it could be up to 99 times even if the patient needs it, way less strict than those controlled medications. These medications also have limits on the amount of times that they can be transferred. So C2 medications are not allowed to be transferred from one pharmacy to another unless you take the prescription back. The pharmacy that you take the prescription to is the pharmacy that has to fill the prescription. C3 through C5 medications may only be transferred to another pharmacy once, and then non-controlled medications may be transferred unlimited times as long as the prescription is not expired and has refills. So as you can see here, non-controlled medications have the least amount of hoops to jump through, with the number of hoops increasing as you increase from non-controlled to C2. Then our prescription expiration dates. C2 prescriptions expire 6 months after the date they are written. Similarly, C3 through C5 prescriptions also expire 6 months after that date. And our non-controlled prescriptions expire 1 year after the date they're written. So you get double the amount of time to fill your non-controlled prescriptions than you do for your controlled prescriptions. So now we're going to talk about the actual receiving, processing, and preparation of prescriptions. All of these tasks that we're going to discuss are going to be geared towards community pharmacy prescription processing. However, a lot of these tasks can also be seen in hospital pharmacy. They're very similar. So we're going to walk through a typical community pharmacy workflow from prescription drop-off all the way to the patient returning to pick the prescription up. These steps include drop-off, data entry, adjudication, dispensing, verification, and pickup. Starting with drop-off. So drop-off is one of the two critical areas of the pharmacy where you're going to have face-to-face interaction with the customer. So your actions, tone of voice, empathy, and respect for the patient are going to set the tone for how the remainder of this entire transaction is going to take place. So when the customer approaches you at drop-off, your first step is to collect information from them. There are some pretty common questions that you may ask the patient at this point. So the first would be, have you filled here before? If the patient says yes, you're going to verify their name, date of birth, and ensure that both of those are written on the prescription. If the patient's never filled here before, you're going to want to collect the patient's name, date of birth, gender, allergies, address, phone number, and insurance information so that you can get started on their prescription. Then from there, you may ask them, which doctor did you see? You ask this question if you're not 100% sure who the prescriber is. So if they present saying they're looking for an antibiotic from their doctor, you may say, which doctor did you see? Just to help you navigate where that prescription should have came from. Then you can say, let me make sure we have this in stock. This step ensures that the patient does not wait for a prescription that you don't have in stock at that time. So if a patient brings in a prescription for 10 amoxicillin and you don't have 10 amoxicillin on your shelf, you don't want the patient to wait in your pharmacy when you're not going to have the prescription. So this is a great time to step away, look on your shelf, make sure you have enough to fill the prescription, then tell the patient, hey, I'm going to have to order this. Can you come back tomorrow? In that same breath, you can ask them, when would you like to pick this prescription up? So when giving an estimated wait time, you need to make sure that you're taking into consideration any other customers that are waiting, as well as the number of prescriptions in front of that patient. So if you're having a really heavy day, make sure you're setting realistic wait times for your patients so that they're not trying to come back to get prescriptions before other people. So in collecting all of this information, make sure that you're still being cognizant of the patient's privacy. You still need to follow HIPAA, which we talk about numerous times in this course. You're going to want to speak in clear, low tones and only ask what's necessary to begin the dispensing process. Always ask for medication allergies and document them. Patients can be allergic to medications that are in the same class of medications that they are allergic to. So an example of this is if a patient has a penicillin allergy and they get a prescription for amoxicillin. If we don't have the penicillin allergy on file, we may not know that. And then since amoxicillin is in the same class as penicillin, the patient could also be allergic to amoxicillin and that could harm the patient. Next, we have the data entry step. So this portion of the workflow focuses on the interpreting and entering of the patient's demographic and prescription information. This is the step that's the most important for having accuracy because it can easily trigger errors downstream in this process. It's really up to you to enter this information right the first time, even though you have a pharmacist checking behind you. So we're going to discuss the 5 rights of patients as well as interpreting prescriptions. That way we can really dive into how you enter these prescriptions into the system. Starting with the 5 rights of patients. Patients have the right to the right drug, right route, right dose, right time, and right patient. So what this means is they have the right to have the right drug dispensed to them that their doctor prescribed. It should be prescribed by the same route that their doctor prescribed. So if the doctor says they need to take it by mouth, they shouldn't receive a cream. It should be the right dose that the doctor prescribed. It should be administered at the right time. So if the doctor writes that the patient should administer their medication at bedtime, Making sure that you put on the label that they need to take it at bedtime so they don't take it in the morning. And then finally, the right patient. So making sure that we're not choosing the wrong patient when we're entering the prescription information, because then the wrong person could end up with the prescription. So this leads us into the interpreting prescriptions portion. The purpose of this particular section is to provide additional information for how to interpret the prescriber's information. Some of the SIG codes that you're going to see are going to be very familiar, whereas others are going to be foreign to you, and we're here to help with that. So we're going to start with what even is a SIG and then look at the components of a SIG. So when you receive prescriptions, the directions will commonly be written by providers in a shorthand known as a SIG. SIG is derived from the Latin word signa, which literally means, quote, you write. So remember, like I said, that while you're going to be checked by a pharmacist, it's vital that you interpret the abbreviations and directions for use accurately. The patient's going to take the medication however you transcribe it onto the prescription label. So if you enter the directions wrong and the pharmacist misses it, the patient's going to take it however you wrote it. So the patient's going to take it wrong. So it's really important that you put a lot of effort into making this as accurate as possible for the patient. The components of a SIG includes the route of administration, so the action, how they're going to give the medication, the number of units and dosage forms, so how many of what are they taking, the route of administration, so where are they taking it, the time or frequency of dose, so how often are they taking it and when are they taking it, and then there's some common miscellaneous. So to put this in perspective, administration may be take, and the number of units and dosage form may be 1 capsule. Route of administration may be by mouth, and time or frequency of dose may be once daily. So putting all of that together, you have all of those pieces, and it's take 1 capsule by mouth once daily. Pause it now so that you can review these each individually. Feel free to. This is similar to everything that we have seen so far, just understanding this shorthand abbreviation so that you can accurately transcribe it over to the prescription label is all that I can really reinforce here. So starting with the administration, I'm not going to spend too much time here, but you see examples such as take, apply, insert, instill, use, and inhale. So these are all going to tell the patient how to take their prescription. Then you'll have your number of units. These could be in Roman numerals, Arabic numerals, or even apothecary symbols. Just making sure that you're able to accurately tell how many of something that the patient's supposed to be taking. Then we get into strengths and system of measurement. I have some pretty common systems of measurement listed here. If you want to pause the video now so that you can review each one individually, I'll go ahead and give you a chance to. So a common practice when transcribing onto a prescription label is to not only include how many of the dosage form the patient's taking, but what strength that dosage form is. For example, if you were dispensing lisinopril 10 milligrams, it's pretty common to say, take 1 tab and then in parentheses 10 milligrams by mouth once daily. So this is where these systems of measurement come in handy. Then we have our dosage forms. Again, I'm going to give you a chance to pause and review each of these abbreviations for dosage forms individually. So just the same with the system of measurement, just making sure that we know these abbreviations so that if a prescriber writes this abbreviation on a prescription, we can accurately transcribe this from the prescription over onto the label. So if a prescriber were to write 1 amp daily, so 1 amp QD, which we'll get there in a moment, you know to prescribe 1 ampule or transcribe 1 ampule daily. So just taking that shorthand and turning it into its full version. Certain medications are only available in one dosage form. In that case, the doctor may choose not to express a dosage form at all and subsequently not express a route of administration. You should never add any additional information without consulting the pharmacist. So if you get a prescription that has pieces of the SIG missing and you're not quite sure what the prescriber intended, make sure that you check with your pharmacist before entering it to make sure that you're entering the correct dosage form, the correct route, and giving the patient those 5 rights. Then we have our route of administration. Again, you can pause here to review all of the common abbreviations, the shorthand for these. These are pretty difficult, so I recommend that you make flashcards with these or utilize the flashcards we have in the chapter to study these just so you can remember the abbreviations. We also have abbreviations for frequency listed here if you want to pause now to review them. So this is similar to all the other abbreviations we've seen thus far, that the doctor may write some form of these shorthands as part of the SIG, which will then ultimately get transcribed to mean the full meaning. Then finally we have the miscellaneous ones. You can pause again as well to go ahead and review these. Once again, these are miscellaneous SIGs that may be tacked on to the end of a prescription for whatever reason if the prescriber needs to add clarification. So the same as we've seen with all of the rest, just understanding these shorthands so that you can put them all together and then ultimately translate the SIG into the patient's label. Now we're going to discuss the adjudication process. Adjudication is the submission and subsequent response of a claim to an insurance company. In most pharmacies, this happens almost instantaneous. Then we have dispensing. So this is after you've already billed the insurance, you'll look into dispensing the actual medication. This step of the workflow process includes choosing the correct medication, counting the appropriate numbers of dosage units, and preparing the prescription for sale. This step is very important as it could be extremely dangerous if the wrong medication is dispensed to a patient. So some of the things we're going to take into consideration is the manufacturer's label versus the prescription label, automatic medication counters, accuracy scanners, safety caps, counting trays, controlled medications, liquid medications, auxiliary labels. So as you can see, this is where the gut of the dispensing portion happens. This is where a lot of the prescription preparation part happens. This is the actual counting of the pills. So the manufacturer's label typically includes the medication's brand name if applicable, generic name, strength, quantity, manufacturer, lot number, expiration date, and NDC code. Prescription medications typically will have RX only written on the label to differentiate them from OTC medications. And you could check your manufacturer's label for special storage conditions to make sure you're storing medications how they're intended to be stored. Contrary to the manufacturer's label, then we have prescription labels. So these include the medication name, strength, quantity, directions, patient's name, prescriber's name, the prescription number, expiration date, refills remaining, pharmacy name, as well as the pharmacy phone number. So labeling your prescriptions as you dispense them helps you to keep track of what vials contain what medications and prevents vials from getting labeled incorrectly. So as soon as you count pills, the second that you put pills into a bottle, make sure you go ahead and label that bottle. So if somebody walks up behind you, they know what's in that bottle. It's not a mystery pill that's in the bottle. Everybody's aware and everybody's safe. It also prevents that bottle from getting picked up and getting the wrong patient's label put on it to where the patient may receive the wrong medication. We also commonly use accuracy scanner. They're used to verify the correct medication was used to fill prescriptions. So you're going to typically scan the medication bottle's barcode, so the actual bulk bottle, then scan the prescription barcode. This is going to validate that you chose the correct medication before you ever even start counting the pills. Your pharmacy may also use automatic medication counters. These are commonly used to streamline the dispensing process by eliminating the need to count medications by hand. These machines are faster than even the most seasoned techs. Automatic medication counters also improve accuracy, ensuring that the correct number of doses is counted each time. Make sure you do not count sulfa medications or amoxicillin in these machines. Some people are allergic to them, and the dust may cause cross-contamination with other prescriptions. So if you count sulfa medications or amoxicillin or anything like that in the machine, powder may get left in the machine. And when you go to use the machine for future patients, if that patient has a sulfa allergy or a penicillin allergy and the powder is in the machine, it actually can cross-contaminate to other tablets, which will then cause the patient to have an allergic reaction, which we don't want. Then, by far the most common method is the counting tray. When you count prescriptions for dispensing, you'll commonly use a counting tray and a spatula. You should count by whatever pattern you're comfortable with. Some people count by 2s, others by 5s. I personally count by 5. Do whatever makes you feel comfortable and the most accurate. That's what's important. So starting, you're going to open the reservoir, which is what you see on the far left-hand side of this counting tray. Using the spatula, you're going to want to roll the tablet or capsules in increments that you're comfortable with into the reservoir. So that's what you're seeing happening in the top. The reservoir is open and they're gradually sliding tablets down into the reservoir. You do this after you pour the medication that you plan to count onto the flat portion of the counting tray. Then you move on to closing the reservoir after you have the number of tablets you want in there, and you'll align the opening of the reservoir at the bottom. You can see a small circular opening in the picture with the top of your medication vial, and you'll allow the pills to fall into the medication vial. So at this point, you've poured your pills onto the tray. You've counted them 5 by 5 into the reservoir to the left. You've now closed the reservoir top. You have emptied all of those excess pills back into your bulk bottle, and you're going to dump all of your pills for your prescription into the vial. Once you're finishing up, make sure you place the cap on both the medication stock bottle as well as the freshly dispensed prescription. Immediately label your prescription vial like we talked about, and make sure you clean your counting tray between prescriptions to prevent cross-contamination like we talked about. This is really hard to demonstrate, so I would suggest looking up a video online or watching a coworker when you start. But this is the best that we could really do to describe to you the overall process of counting tablets with the counting tray and a spatula. So when you put the cap on your medications, you should definitely be using safety caps. All prescriptions have to be dispensed with child-proof safety caps by default, with the exception of nitroglycerin and non-oral dosage forms. So patients may opt out of receiving safety caps on their prescriptions. In this situation, make sure that you're documenting this in the patient's chart for future dispensing, both to make sure that it's legally taken care of, but also to make sure you don't dispense the wrong cap to the patient in the future. So now just briefly visiting controlled medications. The medication name, strength, quantity, prescription number, and patient name should be logged before dispensing. You always want to make sure you're double counting your controlled medications to ensure that you dispense the correct quantity. Your standard operating procedures should outline to you what this logging process should look like. Then we have liquid medications for dispensing. Always ensure that you're selecting the correct liquid enclosure so that you're putting it in the correct bottle. You want to pour the medication with the label on the manufacturer's bottle facing up to avoid the label getting soiled if there's spillage. So if you pour it with the label facing down and any of the liquid spills down the side, it'll get on the label. So try to pour it with the label facing up. And then you're going to want to dispense it with a compliance aid capable of dispensing the correct dose. So an example of a compliance aid can be seen up in the top left with a dosing cup or an oral syringe, just making sure that it actually goes to whatever dose the patient needs to take. And the final portion of the dispensing process is auxiliary labels. They're useful for providing information to the patient about how they should take their medications. All suspensions should have a shake well auxiliary label. Other common labels include take with food, may cause drowsiness, and keep refrigerated. So just apply these the best that you can. If you're not quite sure which labels go on the prescription, your pharmacist will double check them, but it's definitely helpful to go ahead and add these as you know them. Next, we have verification. The most important thing that you need to know as a pharmacy technician about this step is that it's a pharmacist-only step in most states. The pharmacist checks that every element of the prescription is correct. The pharmacist also checks that any calculations that are done are correct. Finally, the pharmacist checks if the medication could cause any drug-drug interactions or contraindications that could hurt the patient. Now that the prescription's verified, we're at pickup, so this is the last step of the workflow in which the patient returns to pick their prescription up. So this is also when the pharmacists are going to counsel patients on new prescriptions. Here's what you can do. You can always ask for the name and date of birth to ensure that it's the correct patient that's picking the prescription up. You can ask how many prescriptions the patient is picking up to ensure that they get them all. You ask if the patient has any questions about their prescriptions, just in case the pharmacist does need to counsel them or answer any questions. And if it's a new patient, provide them with a copy of your pharmacy's privacy practices and your HIPAA. This allows you to have a bridge of communication with the patient that's also legal. Now we're going to take a look at some confusing abbreviations as they relate to the prescription interpretation process. Some abbreviations can get misread, especially depending on the handwriting. So we've included some of the commonly confusing abbreviations here for you so that while you're going through interpreting SIGs, you can really start to sort through these. So the first we're going to touch is AD, AS, and AU versus OD, OS, and OU. So to avoid this, you can explicitly write out right ear or right eye to make sure that it doesn't get confused between whether or not the patient should put it in their ear or the eye when you're transcribing the prescription. Same with HS capital and lowercase hs. Sometimes this means bedtime and sometimes this means half strength. To avoid this confusion, you could just go ahead and write out either half strength or bedtime. Then explicitly write out daily or every other day or 4 times a day with QD, QOD, and QID. So these can commonly be confused. A good way of avoiding it is, like I said, just going ahead, writing the full word out. Finally, lowercase ss, uppercase ss, and then uppercase SSI. These can mean 1/2, single strength, or sliding scale insulin, which are all very different. So just go ahead and write out what you mean whenever you're writing these abbreviations, just to avoid the confusion with other practitioners. There are also some medications as you're filling prescriptions that are going to look alike or sound alike. These are called look-alike, sound-alike medications. The ISMP, or the Institute for Safe Medication Practices, releases a list of these that's located in the chapter. So some of these medications are going to have tall man lettering to draw attention to the medication name. You can see examples of these below. If you want to pause it now and take a look at these, you can. We're comparing bupropion to buspirone, prednisone to prednisolone, nifedipine to nicardipine, hydroxyzine to hydralazine, and glyburide to glipizide. So you can see where these could very easily get confused in saying or writing. Zeros can also be very confusing in prescriptions when you're interpreting them. It's important that when you're filling the prescriptions to never use trailing zeros or leave a decimal mark blank. So a trailing zero is a zero that's placed after a decimal that has no other number to the right of it. So for example, if a prescription is written for 1 daily, you may write that SIG code as take 1 in parentheses, tablet daily, by mouth once daily, not take 1.0 tablet by mouth once daily. An example of leaving a decimal mark blank would be not placing a zero before a decimal mark. For example, if a prescription is written for 1/2 daily, you may write that SIG code as take 0.5 tablets by mouth once daily, not take 0.5 tablets by mouth once daily. So the whole reasoning behind this is when you use a trailing zero, that 1 may now look like a 10 to the patient. So the patient may read that as take 10 tablets by mouth once daily. Similarly, in the blank zero situation, instead of reading take 0.5 tablets by mouth once daily, they may just read take 5 tablets. So it's very important to watch your zeros as you're transcribing these prescriptions. And again, we have some more correct examples. So take 1 tablet by mouth once daily, take 0.5 tablets by mouth twice daily, take 10 mLs by mouth once daily. The ones at the bottom could have been read as take 10 tablets by mouth once daily, take 5 tablets by mouth twice daily, and take 100 mLs by mouth once daily. So again, really important that you're paying attention to those zeros. Now we're going to look at some common prescription errors. You know the types of prescriptions, the prescription requirements, and the general workflow for preparing prescriptions. Let's talk about common prescription errors. The prescription errors can lead to unintended consequences all the way up to death. For this reason, it's super important that we're able to prevent these errors. So we're going to look at missing prescription requirements, incorrect medications getting dispensed, expired medications, incorrect patients, as well as incorrect directions. So starting with missing prescription requirements. Sometimes a physician may forget to include part of a prescription, such as his signature or the number of tablets he wants you to dispense. The solution to this is to fix the problem, alert your pharmacist of the missing information. Depending on the type of prescription, the pharmacist may just call the physician for clarification, or the patient may need to bring in a new prescription with the needed information. So, in this situation, always take it to your pharmacist's attention so that they can troubleshoot with the physician what needs to happen in order to fill in the missing requirement. Sometimes it may be an incorrect medication. So as we learned about, some medications may look or sound alike, causing them to be confused with one another. This is extremely dangerous as a patient could get a medication that they're not prescribed. So to fix this problem, be sure to double check the name of the medication as well as the NDC code you're using prior to dispensing the prescription. Technology such as barcode scanners definitely does help to eliminate these errors. Then we have expired medications. Sometimes a medication that's going out of date can slip through the cracks while doing inventory. This causes the patient to receive a medication that's expired. To fix this problem, make sure you follow your pharmacy's standard operating procedures or SOPs for checking expiration dates. A good rule of thumb is to check all inventory for outdates at least once a month and to pull medications going out of date 3 months in advance to make sure they don't ever get to the patient. Then we have an error with an incorrect patient. Sometimes when a patient drops off a prescription, they may have a name that is similar or even the same name as other patients at your pharmacy. This can lead to a prescription getting filled for the wrong person. So the solution to this one is to always ask and verify your patient's name as well as date of birth at both drop-off and pickup. So this is going to ensure that the correct patient gets their medication each time and the wrong patient isn't getting their medication. Then we have incorrect directions. So sometimes the sig of a prescription can be a little difficult to read, resulting in the wrong directions being printed on the patient's label. So all of that interpreting, all of those abbreviations we just looked at, the doctor is going to write the prescription, and on the prescription they'll include those abbreviations. It's your job to transcribe them over to the label like we talked about, but sometimes they get transcribed wrong. So to fix this problem, make sure you're asking clarifying questions for any confusing SIG codes. Start by asking your fellow technicians, then your pharmacist, and ultimately, if you're still unable to decipher the prescription's directions, or prescriber's directions even, call the prescriber's office for clarification, documenting any information you receive. So call the prescriber's office and you could say, "Hi, Dr. Johnson, I received a prescription for you, or from you, for a patient. The patient's date of birth is this. I'm having trouble reading the directions. Would you mind clarifying those for me?" And then you'll go ahead and you'll write down whatever they say. If it's the doctor's nurse, you'll write down their name, you write down the date and the time that you spoke with them, and then you go ahead and fill the prescription with that clarifying information that you received. So we're going to talk about a few other considerations with the prescription preparation process, including counseling, hygiene, as well as reference manuals that you can use. Starting with counseling, this process involves the pharmacist talking to the patient for any variety of reason to ensure they feel comfortable taking their medications. So as a pharmacy technician, you can help your pharmacist identify patients that may need counseling. Examples of patients that may need counseling on their prescriptions include those that are receiving new prescriptions, getting a late refill on old prescriptions, reporting adverse effect from a prescription, a candidate for a vaccination, and those receiving a change to their prescriptions. So now we're going to look at a couple different patients in this picture, and we're going to decide how to identify and triage patients that may require counseling. So the people that are the most important for needing counseling are towards the center. The people that are the least important are towards the outside. So here on the outside, we have Miss Williams, who's 24 years old, who needs a flu shot. She's probably the lowest priority at this point. Then we have Mrs. Johnson, who's 36 years old and just had her medication dose changed. She's a little more important, but she's been taking this medication before, so we know that it's safe for her, and hopefully her doctor talked about it. So if we can get the pharmacist to talk to her about the new dose, that's great, but not quite as high of importance as some of the others. Then we have Mr. Martin, who's 55 and has late refills. Late refills are an indicator that patients aren't taking their medications as they're supposed to. So this is a pretty high importance because the medication isn't going to work for patients unless they're taking it. So Mr. Martin is a little bit higher on the pharmacist's radar for needing counseling. So as a pharmacy technician, if you know he's missing his refills, you know he's late, you can bring up to your pharmacist that you think Mr. Martin requires counseling. Then finally, we have Mrs. Lee. She's 84 years old and she's starting 3 new medications. Anytime you're sending somebody home on a new medication, especially numerous new medications, you want to make sure they're well educated, they've talked to the pharmacist, and they're comfortable before they leave. So this is a good example of 4 different people that could use counseling, but being able to triage them and prioritize them based on what they need. So now diving deeper into your role as a pharmacy technician in counseling, you absolutely can, green light, offer every patient the opportunity to speak with the pharmacist by asking, what questions do you have for our pharmacist today? You could do this with absolutely any patient. Then the yellow light, stuff to start working on, is continuously work to identify patients they may need counseling and refer them to the pharmacist. So work diligently to try and find those patients that are at higher risk and then get them to speak with the pharmacist for help. Finally, the red light, do not pass go, do not do this, is do not counsel the patient yourself, even if the pharmacist is busy. Ask the patient if they would like to have the pharmacist call them to discuss any concerns. Even if you feel comfortable with what the pharmacist is going to say, you are legally not allowed to counsel patients. You are able to refer them over to the pharmacist, but make sure you're not giving medical advice to any of the patients. Now looking at pharmacy hygiene, this ensures a safe workplace. So just make sure that you're disposing of your vials and medication bottles in the appropriate place and ensuring they're not on the floor or the counters. Regularly remove shredding and trash to prevent clutter and disorganization. Clean common surfaces such as telephones, keyboards, and pill counting trays regularly with alcohol. And follow your pharmacy's standard operating procedures, or SOPs, for end-of-the-day cleaning policies. Just making sure that the workplace is safe for both the patients as well as you. Then we have workspace hygiene. So this is the actual space that you'll be counting prescriptions, your computer, all of that. This ensures your medication safety. So aim to only work on one prescription with one medication at a time to prevent dispensing the wrong medication for the wrong prescription. Clean your workstation often with alcohol to prevent contamination, like we've talked about. Clean your counting tray between prescriptions to prevent cross-contamination, like we've talked about. And at the end of your shift, be sure to return all supplies to their designated location for the next technician, just making sure that everything's in its appropriate place for the next person. Then we finally have hand hygiene. This ensures your safety. So make sure you're washing your hands after using the restroom, as well as any other time hands are soiled. Use hand sanitizer often during your shift. Hand hygiene keeps medications from penetrating and irritating the skin, should your skin contact them during dispensing. So if any of the powder gets on your skin, this is going to help you from getting irritated. Hand hygiene also prevents illnesses from spreading from objects to you, as well as prevents illnesses from spreading from you to others, as you are going to see patients with poor immune systems. So patients are going to be coming in sick. You're going to be handling prescriptions that they hand you after they've been sick. So washing your hands will really help you to prevent from getting sick from some of these prescriptions you're going to be handling, but also prevents you from passing anything on that you may not know that you have to people that may be sick. Finally, we have reference manuals. So sometimes you may fill a prescription for a patient or medication that you aren't typically used to. In this event, you may need to use a pharmacy reference manual. Common pharmacy reference manuals and their uses include the facts and comparisons for drug information, the physician's desk reference for drug information and package inserts, the American Drug Index for drug information, Handbook of OTC drugs for over-the-counter drug information, U.S. Pharmacopoeia for drug standards, Handbook of Injectable Drugs for IV solutions, drug-drug compatibilities, Red Book for average wholesale pricing, the Orange Book for therapeutic equivalencies. So now tying this all together, the first step in preparing a prescription is to understand the type of prescription you have, as well as all the features of that type of prescription. Preparing a prescription is a multi-step task that begins when the patient drops off their prescription or calls in a refill, and ends when the patient picks the prescription up. Each step of the prescription preparation process is aimed at keeping both you and the patient safe. Important considerations when dispensing prescriptions include the dosage form, lookalike medications, trailing zeros, and more. We have plenty of practice within the chapter for you to practice interpreting prescriptions. Please feel free to use the worksheets, use the study cards, use the quizzes. All of those will help you to really solidify this information. Thanks.